I'm preparing to make an announcement to my current patients about my new services and other administrative charges that I will be implementing, as well as my fee increase. I did just increase my fees in February of this year by about 15%, and the increase to the new fee structure would be anywhere from 40 to 80%. So what would be a reasonable time frame to make the new fees effective? Or would you recommend a different strategy to get my current patients up to the new fees? So if I'm understanding correctly, you raised your fees by like a smaller percentage. I forget what month you joined my program after February. Wasn't it around then? Was it like March?
It was like mid to late March.
Okay, all right. So before joining, you did like a more modest fee increase. Join, you're like, hey, I want to actually increase them more and tie that into also offering more value, offering additional services. So was it across all your patient panel you increased fees by about 15%? It was only certain patients in February?
It was across all, and maybe like one person who was like, I can't do that. And then I ended up just keeping them at their previous fee.
Okay. So I'd say because you semi-recently increased fees, you probably would want to give patients a little bit more notice. You know, if you hadn't just increased fees, you'd probably get away with like less notice. I mean, I would probably in the letter you send out announcing it, or if it's a conversation, acknowledge like, hey, I know I just increased fees in February, but I'm doing it again for XYZ reasons. It's going to go along with these additional services. I understand if this doesn't work for you. First of all, these fees won't be effective for you for, I don't know, let's say 3 months maybe. And if it doesn't work for you, I'll extend that period of time and work with you to transfer you to another clinician where it's a better fit in terms of the fee structure. So I would say giving them somewhere between 3 and 6 months notice for like that big of a fee jump.
Would you consider like, I don't know, jumping them in steps maybe?
I wouldn't. I would just like rip off the Band-Aid, because the thing is, you're going to that fee, you don't need to pull any punches. I would just put it out there, acknowledge it's a jump, and then, you know, say like, this is the extra benefit you'll get by continuing to work with me, but if it doesn't work for you, I totally understand. I'll help transition you to someone else. And I would say for patients where it's like 80%, I would probably lean toward the 6 months of notice. If it's like 40%, maybe 3 months is enough, because chances are patients where it's a bigger jump, fewer of them are going to be able to stick with it, and you want to give them more time. You want to give them more notice, more time to maybe for you to help both like stabilize them, and then also to help transition them where you're not both trying to get them to someone else while also making a bunch of med adjustments because they're not doing well. Hopefully by the time you're transitioning them, they're relatively stable and it's just for kind of routine check-ins.